Monday morning house call time. We are here with Christy Meeks. Christy, I chose this profession. My mom kind of wanted me to be a doctor when I was a kid, but you don't have to talk about blood and all that stuff if you're in my position. But you make it sound okay. You kind of make it sound like it's something that's okay to deal with.
Well, if I didn't deal with it, you surely wouldn't, right?
That's so true. Last week we talked about burns. We're going to talk about cuts and scrapes. So
Yes.
Why don't you fill us in a little bit?
What we're talking about today is some minor cuts and scrapes, stuff that you ride your bicycle, fall off, scrape your knee a little bit, nothing major. You know, if you're profusely bleeding, something gashed wide open, you know to
Hopefully
go to the doctor.
you're not watching right now if that's a situation. So
Yeah, you're already on your
stuff.
way out the door. Any kind of minor scrape or cut usually does not require any kind of emergency room treatment or anything like that. So I've gave you a few little things that you can do to keep safe at home without, and avoid the doctor.
We love your list, so why don't you just go ahead?
Okay, first thing you want to do is if it's bleeding, stop the bleeding. What you want to do is get a clean cloth. Don't worry about cleaning it straight up. Just go ahead and apply pressure for 20 to 30 minutes. Usually most bleeds stop on their own within 20 to 30 minutes. If you're not seeing that it's doing that, then that's an indication you probably want to go to the doctor.
Get onto the hospital or something.
Yeah, keep the pressure applied and then that should quit. Do not keep lifting the towel or the rag off to see if it's quit bleeding, because that's breaking the clot loose. That's causing it to keep, it's causing it to go ahead and start bleed again. The second thing that you want to do is then, after it's stopped bleeding, clean the wound. Mild soap and water. Try to clean around the wound really well. You don't necessarily have to get it in it. Try to avoid getting it in it just because it's a little bit painful, but it's not going to hurt you.
It's the worst part as a kid.
Yeah. And if you have anything embedded in there, get you some tweezers and kind of pick it out. Like if you're falling on gravels, you may have a few little rocks stuck in there. Go ahead and get you some tweezers, pull it out the best you can, scrub it again. Third thing you want to do is get an antibiotic ointment. Like I said last week, the antibiotic ointment is not necessarily making it heal quicker. It's just protecting it from germs entering the site. It keeps it from getting infected. Put the antibiotic on and then put the dressing on. You want to keep your dressing clean and dry. Anytime that you get it dirty or wet, go ahead and change it, but at least change it once a day. The last thing you want to do is make for sure you're updated on your tetanus shot. You usually, at 6th grade, is your last tetanus shot. After you've had that tetanus shot, every 10 years you get a booster. So if the cut is bad enough, a doctor may recommend, hey, I know it's been 5 years since your tetanus shot, but we're going to go ahead and give you one anyways. So you may want to consult your doctor. That's if you can take care of all this at home and you're not sure about the tetanus shot, go to the doctor anyways, because that tetanus can set up some really bad stuff, which I'll tell you more about next week.
Yeah, you hit it right on the head. We're going to be talking about tetanus shots next week. So if you heard a little bit and you said, I want to know more about this whole tetanus thing, join us next week. You're watching Mountain News This Morning.